The GRIFFIN study was a small run-in presentation of a bigger study which has completed enrollment, but it's one of the most important studies currently conducted. This is a study in which patients are randomized to our US standard of care frontline treatment with RVD or VRD, depends on the name which you prefer to use, with or without daratumumab, and the patients are scheduled to receive transplant. So this is for transplant candidates with plan for treatment with patient with a short course of RVD or DARA RVD, post-transplant followed by maintenance with either Revlimid, Velcade-based regimen, or with daratumumab on daratumumab arm. So very specifically designed study to look for potential improvement of treatment with RVD and transplant by adding on top of that lenalidomide, Revlimid. And that particular subset portion of the study which was presented at this meeting was first cohort of patients, 16 patients who have been treated on daratumumab arm without randomization. And Dr. Wurr has presented the data which look to me, I would use the word amazing. In short, there was no much of added toxicity, which is important, was part of the reason why it was conducted, so the study could proceed to randomization. Efficacy, which is eventually shown here and maybe summarized by me as best response, is just as good as it gets. Very good partial response, 100% response was seen in 100% of patients. Very good partial response, 90% reduction of the disease. Complete responses were, I don't remember exact number, but were in the high 60-70% range. And there was no unexpected problems which have been, would have been observed. So in a way, if anybody is anticipating that RVD and daratumumab might be future therapy, that initial report is looking very promising, and it is something which will eventually just require confirmation and GRIFFIN study. I would add to that we already have press release from Cassiopeia study, which was similar design but with VDT, thalidomide instead of lenalidomide, in a similar approach, and the study is positive. There is no huge difference between VDT and RVD except toxicity higher in VDT with neuropathy. So I anticipate that GRIFFIN study will eventually become a positive study, and that very quickly RVD and daratumumab may emerge as the treatment of choice. That may be a year or 2 years away before we know these results, but this report at this meeting is more than encouraging. And I would add that this is not the only effort in quadruplet with daratumumab. I mentioned about Cassiopeia. There is also presented earlier by me at ASCO meeting about a year and a half ago, KRD and daratumumab. The very active regimens are performing well. At this meeting, Dr. Kumar presented dexamethasone RD daratumumab, which by indirect comparison seems to be not as active as RVD and DARA, but that's something which we need to wait until those studies mature and give us a little bit more information. Besides, eventually what counts are randomized trials which are in progress.